Hi, my name is Matt Harper, and this is a presentation on type 2 diabetes. The objectives of my presentation is to educate the audience on type 2 diabetes and what it is, risk factors, complications, and prevention. I just wanted to first off, though, start off the presentation just with some scary facts. Just have some numbers here from the American Diabetes Association, um, just to kind of give you a little look into the numbers on what's going on with diabetes and the state of type 2 diabetes. Um, so in 2018, 34.2 million Americans, aka 10.5% of the population, had diabetes. Nearly 1.6 million Americans have type 1 diabetes, including about 187,000 children and adolescents. Um, and of the 34.2 million adults with diabetes, 26.8 million were undiagnosed, and 7.3 were undiagnosed. Sorry, 26.8 million were diagnosed and 7.3 undiagnosed. For prevalence in seniors, for Americans 65 and older, it's very high at 26.8%. There's 1.5 million new cases in America every year, and 88 million Americans aged 18 and older had prediabetes in 2015, and that number just keeps going up. Pretty scary facts. So, what is type 2 diabetes? So, type 2 diabetes is actually the most common form of type 2 or of diabetes. Um, when comparing to type 1, the differences between type 1 and type 2 is in type 2, the body does not use the insulin properly. So that could mean the insulin isn't working properly, the body just is not using what it has, and sometimes it can mean it's not producing enough. In type 1, the body has a hard time producing sufficient insulin. So that's the main difference between the two. Type 2 diabetes may be controlled with a healthy lifestyle. Keyword is controlled, not a cure. So that involves diet and exercise. You may need medication or insulin to manage it, but this does require treatment and interventions. And keep in mind, with type 2 diabetes, there is no cure. Risk factors are ages 45 and older. That doesn't mean that people under 45 can't get it, because you definitely can. It's just more common if you're 45. You're at greater risk. Um, Ethnicities come into play here. So African Americans and Latinos, American Indians, Asian Americans, or Pacific Islanders, they have a greater risk to get it. Once again, doesn't mean that other ethnicities that aren't listed can't get it. It's just the risk is greater with these populations. If your family has had history with diabetes, such as your parent, brother, or sister, that increases your risk. Um, Being overweight increases your risk. There's a study found that actually I found pretty interesting. Neck circumference had um, a higher instance. So with diabetes, so the bigger the neck circumference, they found that you had a higher risk for diabetes. It was pretty interesting. Sedentary lifestyle. So just kind of sitting around, living a lifestyle that isn't active, that increases your risk. Um, a study showed that exercise training has shown to alleviate depression among people with diabetes. So exercise is a big thing. People with high blood pressure or take medicine for high blood pressure have a greater risk, as well as low HDL cholesterol, which is known as the good cholesterol, and or high triglycerides. If you've had diabetes during pregnancy, that increases your risk, as well as family history. Symptoms, there may not be symptoms at first when you first get it, but as the disease process progresses, you may see signs of increased thirst, urination, and hunger, some unintended weight loss. You may feel fatigued, blurred vision. You may find that some sores you have been getting are slow healing than they used to be, and frequent infections, and also areas of darkened skin, and those are usually found in the armpits and neck. Um, Also, tingling, pain, or numbness in the hands or feet. Um, that is a symptom, and that kind of goes into something we'll talk about called neuropathy. And complications. Um, so, like I mentioned, nerve tingling or numbness, that can be caused due to nerve damage from diabetes, and that is neuropathy. Usually in the extremities, hands, feet, could be pain, numbness, tingling. It's a horrible thing if you've ever talked to someone with bad neuropathy. Nausea and vomiting, diarrhea, constipation. This is due to the damage of the gastrointestinal nerves that the diabetes causes. Men, it can cause ED. Um, Eye damage is a big one. Um, the blood vessels in your eyes can be damaged due to the diabetes disease process, so it can actually lead to blindness if left untreated. You get kidney damage, uh, slowness to heal, like mentioned before. Hearing impairment is more common in people with diabetes. Skin infections can be bacterial or fungal. Sleep apnea, which alone can lead to a ton of complications. Um, Diabetes has shown um, an increased risk for Alzheimer's. Um, High blood pressure or stroke is a big one due to the damaging of your blood vessels that the disease process does. And most of all, death. So 15% increased risk of premature death compared to people, compared to healthy people. So it's a 15% increase. That's pretty significant. So now I'm going to talk about prevention. So um, there are ways to help you prevent type 2 diabetes. It's out of type 1 and type 2, type 2 is actually one that can be prevented. So that goes along with eating healthy. So when I say eating healthy, that means recommended foods, or recommended is foods that are, vegetables, whole grains, and also foods low in fat and high in fiber. So lower in fat, high in fiber, remember that. Also, a good way to prevent type 2 diabetes is to get active. We're looking for a minimum of 30 to 60 minutes of moderate physical activity or 15 to 30 minutes of vigorous aerobic activity. So, I mean, moderate physical activity, that's not much. It's not telling you to go, run 5 miles every day. Just get up, go for a walk, um, ride a bike, play sport, something like that. For most days of the week, if you get that in, is going to significantly reduce your chance of getting type 2 diabetes. Another huge one for the prevention is losing weight. So they recommend the loss of 5 to 10% of your body weight, which can reduce the risk of diabetes. Also, avoid being sedentary for long periods. That kind of goes along with getting active. So, low activity levels increase your risk for type 2 diabetes. So, you need to stand up and stretch. So, just here are my references, and I just want to leave the presentation um, kind of with an overview. Type 2 diabetes is bad. There's so many health complications that you could get into with that, and it could lead to diseases and even death. So it's so important to know your risk factors and to get up, exercise, live a healthy lifestyle, eat good, avoid a sedentary lifestyle so you can avoid this horrible disease. Thank you for listening.